working day for me as a surgical technologist in the main operating room at Naval Hospital Beaufort consists of thinking 10 or more steps ahead, being ready to successfully assist my surgeon with any type of case, all while expecting the unexpected. Crazy, huh? What do you mean by that? Well, while answering this question, I will be giving you a tool that can be applied to everyday challenging scenarios. Some of you might have been using this principle already, and for some of you, this might be new information. I call it ACT, which stands for Anticipate, Create, and Try. And these three simple words that are at the core of this exciting profession summarize the principle that it can be applied to any challenging situation in our day-to-day life. According to the United States Department of Labor, the scope of work of a surgical technologist is as follows. Assist in operations under the supervision of surgeons, registered nurses, or other surgical personnel. May help set up the operating room, prepare and transfer patients for surgery, adjust lights and equipment, pass instruments and other supplies to the surgeon and surgeon's assistant, hold retractors, cut sutures, and help count sponges, needles, supplies, and instruments. Yes. And how do we manage all of that? Well, ACT. Let's start with anticipate and the importance of anticipation during an invasive surgical procedure, as stated by Sarah, certified surgical technologist, and now orthopedic certified first assistant working at the Beaufort Memorial Hospital, which shared with me the importance of anticipation from her perspective. And most of the cases that they do at Beaufort Memorial, or the most important ones, are total joints, total knees, total hips, joint replacement. And the importance of anticipate is going to give the case a fast flow, which means the incision is going to be open for less time, which is going to decrease the possibilities of infection and other complications. How are surgical technologists able to think of any possible outcome and go from anticipation to actually develop or create the scenario? Well, I'm going to say that education has a huge impact in how are we trained. Well, in order to create, the surgical technologist must be knowledgeable of the basic anatomy that pertains to the specific surgeon. Going back to what Sarah, surgical technologist at Beaufort Memorial, shared with me, one of the first cases that she was doing on day by day when she first started in her profession was a cholecystectomy, or the removal of the gallbladder. And it's a laparoscopic procedure. Well, it's generally done laparoscopically. In this procedure, she got very good at knowing the anatomy of the upper right quadrant, and that is determined for the success of the surgery. So they must think of all the potential outcomes and create those possible scenarios in your mind, and must be ready to change your game plan at any given moment. Now, there is a popular adage among surgeons. They like to say, "Don't give me what I asked for, give me what I need." And most of the times, they have all their attention focused on what it is that they're doing, and it's hard for them to remember the name of the particular instruments that they need next. However, a good surgical technologist will tell you that even if they call a certain retractor by other name, you have to know what they mean, and they will tell you, "Give me what I need, not what I ask for." And this difference can make the situation go very well or very bad. It brings us to try. When the surgeon asks for a scalpel, a good scrub will anticipate that he or she is going to cut. They're going to need next something to stop the bleeding. So they will create the scenario in which after they cut the skin, there will be bleeding, and the next thing that they're going to try is give them a sponge, give them the electrosurgical pen, or something that is going to help them with the bleeding. And this would definitely help you with your day. Is going to go extremely well, or it's going to go extremely wrong. And it marks the difference between being praised or being crucified. From the mundane world of surgical technology, I have shared with you three main points of anticipate, create, and try, and how this basic principle helps me and my colleagues to better assess a challenging situation and to think of any possible outcome and then try different possible ways to provide a solution for it. Let's put things into your perspective or our perspective as USCB students going from the Bluffton campus to the Center for the Arts. And let's say your car breaks down. In this situation, what would you do? If you're already applying the ACT principle, you will assess the situation of anticipate, create, and try, and you would think of the different solutions, and you would definitely make it on class or make it to class on time, or at least make it somewhere. However, if you're not thinking like a scrub, you will lose a lot of time complaining about what went wrong and not confronting the challenge. Therefore, I give you with this food for thought, and hopefully you will apply the ACT principle to your challenging situations with great results. Thank you.